Plenary from European Pain Federation EFIC, and today I am here to talk with Amanda Williams, who will be one of our fantastic plenary speakers in 2025 in France, Lyon. Hi, Amanda. Thank you for your time.
Hi, Sophia.
Can you please introduce yourself briefly?
Yes, I'm a professor of clinical health psychology at University College London, and I've also a clinical psychologist, although I'm just retiring from that role. But I trained as a clinical psychologist and worked full-time in clinical psychology for a while before I did my PhD, and I've moved more and more into an academic role. But I still think it's important to do both.
Okay, that sounds really great. Can you tell us a little bit about your talk?
Well, it's about healthy interventions and pain management, and one could take that in two ways. One would be a very positive psychology take, which there is a literature on, and the other would be to take the much larger literature in the clinical setting on helping patients who are more disabled and more distressed usually than those who are selected for positive psychology trials, and to think about how well the pain management methods that we use align with what we know about general health, because these patients are often in their 40s and 50s and 60s. They may well have 20 or 30 years ahead of them. So we need to be thinking long-term about their health and well-being, which is quite difficult to do when the focus is very, very much on pain. These are people who are going to develop other problems, if they haven't already, cardiovascular problems and all sorts of things that will limit their lives. So the more we think about a healthy middle and old age for them, the better. So I'm going to try to bring these areas together a little bit, and also think about which trials are, how we can look at trials to make sure that they are trustworthy and reliable, and we can take them into our clinical lives, because there's a bit of hype about some of the interventions, and there are also some methodological problems like small samples that mean some studies are just never going to be replicated.
Yeah, I think it's a big challenge to research in this field. What do you find the biggest challenge yourself?
Well, to be honest, I think we're not using theory well enough. We're doing a lot of very practical fiddling around, adding and subtracting bits of treatment and expecting it to make a big difference, but it's very unlikely to make a big difference. And then doing the same in virtual settings or internet settings, remote treatment, which is very good because that at least is a bit more scalable. I mean, there are very literally millions of people with chronic pain. We're certainly not going to treat them all face to face. So I think we're not using theories about behavior change well enough. I think we're not, we need to engage patients more to think about what makes sense to them, because we often spend a lot of time persuading people to even start trying the things that we are convinced will help.
Okay. And why should people come to your talk? Why would you recommend your talk?
Well, I'll try not to say things that I've said before, because they might have heard them before. I'll try to use work we've been doing recently, a group of us, on what makes the literature trustworthy. And that came out of finding that we included and then we excluded from a Cochrane systematic review and meta-analysis several trials which were frankly too good to be true. And they did turn out to be too good to be true, and quite a few have now been retracted. And that was quite worrying that apart from the errors that inadvertently get into the literature, and we know that, and apart from the way that people tend to rather hype their findings in their abstracts, and clinicians they hardly have time to read more than the abstract. There is also some very questionable data in there. So I think talking a bit about how we trust data or not, and also trying to help people think more broadly about what we're aiming for, and getting away from some of the ideas that were innovative in the 60s and 70s and have led to some very good treatments. But if we carry on sticking to them, they're going to hold us back.
Fantastic. It sounds really exciting, the things what you work on. Do you have any final words?
I'm just really glad to see so many psychologists coming to these conferences and, keen to make life better for people with chronic pain. It's not always an easy area to work in. It's not high status within psychology or within medicine generally. And I think there's a lot of compassion and wish to help that we could mobilize better if we can be more critical of our treatments and more imaginative about the next generation.
Wonderful. I think it's definitely important that there are more and more psychologists, and we are really looking forward to your presentation in Lyon. Thank you so much for your time, and I'm looking forward to meet you.
Me too. Thank you, Sophia.
Thank you.